Living with diabetes requires maintaining a strict daily perimeter. You are constantly monitoring glucose to protect your major organs, checking your eyes for retinopathy, protecting your kidneys, and remaining vigilant about nerve damage. But while the focus remains on those major systemic threats, there is a highly localized battleground that frequently goes completely overlooked: the mouth. The data here is striking. This chart shows the incidence of severe periodontitis, or advanced gum disease, comparing people with poorly controlled diabetes against non-diabetics. The diabetic group faces approximately 3 times the risk of developing a severe gum infection. These two conditions are locked in an active bidirectional relationship. They directly influence and amplify each other. Because they feed off one another, treating them in isolation fails. It is biologically impossible to fully control your blood sugar if you are ignoring the health of your gums. The cycle begins when glucose regulation falters. Without sufficient insulin response, blood sugar levels rise uniformly throughout the entire body. That systemic rise includes the mouth. Elevated glucose turns the saliva and gum tissues into a sugar-rich, all-you-can-eat buffet for harmful bacteria. This aggressive bacterial surge happens precisely when the body is least equipped to fight back. Elevated blood sugar actively compromises the immune system. The gums also face a structural disadvantage. Diabetes often impairs blood flow, stripping the gum tissue of the oxygen and nutrients required to heal wounds or fend off the invading infection. High blood sugar systematically dismantles the local defense mechanisms, leaving the mouth defenseless against rapid decay. As periodontal disease takes hold, the gums mount a desperate defense, triggering intense, localized inflammation. The problem doesn't stay in the mouth. Inflamed gum tissue releases chemical signals, inflammatory mediators, seeping directly into blood vessels. Entering systemic circulation, they increase insulin resistance. The body struggles managing blood sugar, driving glucose higher, which feeds back into oral bacteria, accelerating infection. Untreated gum disease acts as an active saboteur, trapping the patient in a self-perpetuating, escalating biological loop. A bidirectional threat offers a bidirectional cure. Actively treating the gum disease makes it easier to control blood sugar, and keeping blood sugar low deprives the gum disease of its fuel. Breaking the loop starts with a systemic foundation, consistent glucose monitoring, and a carefully managed diet. That means prioritizing whole grains and lean proteins to support tissue repair, while strictly limiting the sugary and acidic foods that feed the bacterial cycle. On the local front, aggressive countermeasures are required. Brushing strictly twice a day, flossing daily to remove hidden plaque, using an antibacterial mouthwash to target surviving localized bacteria. Hydration is equally critical. Many diabetes medications cause dry mouth, accelerating bacterial growth. Drinking water physically flushes away debris and bacteria before they can settle. To ensure the loop stays broken, regular professional dental cleanings and checkups are necessary to intercept plaque before the inflammatory mediators can trigger systemic resistance. For individuals managing diabetes, separating dental health from overall medical health is a dangerous illusion. A healthy mouth is a primary, indispensable weapon in maintaining your entire body.